Pigments and eye color. Iris pigmentation and iris color are genetically determined before birth. In this chapter, we will learn about iris pigments and what determines eye color. We will also learn about specific pigments as iris signs and what the various colors of those pigments mean to the health of the body. Let's learn what these colors can tell us. Okay, we just saw the sign called pigments, and now we're going to talk about iris pigments and what they mean. So there are several different colors of iris pigments. One is straw yellow, which can show a tendency for disturbed urinary metabolism, and that is often found close to the collarette wreath. A dirty yellow color is long-term inflammation, low-grade infection. Remember, this is also potential. At the top of the collarette wreath, it can suggest some type of chronic sinus congestion. The orange pigmentation can mean possible liver imbalance or liver disorders. The fluorescent orange is a tendency for gallbladder insufficiencies or gallbladder problems. The dark brown iris pigment is a tendency for liver, which is called hepatic or pancreas disturbances. The rust-colored pigment, that can also mean a tendency for liver imbalances or liver disturbances. There may possibly be blood sugar disorders. The true red pigment we see very rarely, but if we see a true red pigment, especially in the kidney area, there can be a possibility for kidney stones. But true red can also mean kidney dysfunction. Yellow lipid deposits in the sclera are called pinguecula, and we just saw a sign of those, and that can mean disturbed fat metabolism. Brown pigments in the sclera of a blue or biliary, which is a mixed eye, a mixture of blue and brown, can mean liver disorders. Brown pigments in the sclera of a dark brown eye, that is usually normal because they inherited that pigment. A very black pigment called tarry black by iridologists is a tendency for liver imbalance, and it can also mean a tendency for more serious disorders. Now, how do we interpret these pigments? A straw yellow pigment all the way around the wreath. Anytime we see the color of straw, it always means kidney imbalance wherever we see it. But if it goes completely around the wreath, when it's in the top area, we ask about sinus congestion. When it's in the lower area here, we ask about additional kidney imbalance. And when we see the dirty or brownish yellow pigments, we want to look at the areas they're located in. This is a left iris, and this is in the lung area, so there could be congestion in the lungs. So we just ask questions. Do you have coughing or lung congestion? Down here in the kidney area, it can mean a kidney imbalance. Orange pigments. When we see orange pigments, they always mean to ask about the pancreas and blood sugar disturbances. But when we see the orange pigment here, it's actually in the trachea, esophagus area. We want to see if there's any congestion in their throat. And if you see fluorescent orange pigment, that has to do with gallbladder disturbances. So you would ask if they have any pain or aching on the right side where the gallbladder is located. Fluorescent orange all the way around the collarette still means gallbladder imbalances. But when it's around the collarette, remember that term central heterochromia that we discussed. It's in the center part of the iris in the nutritive zone. So I would also ask questions about problems with digestion and absorption. Here we see dark brown pigments. They always mean an imbalance in the liver, wherever you see them. But if you see them in a specific area, For example, this is in a left iris, and this pigment here, right there, is about at 8 o'clock, 4 o'clock, so you'd ask about pancreas disturbances. So it's in the pancreas reaction field. When we see rust-colored pigments like this, we want to ask about liver imbalances, blood sugar disturbances. Also, this goes out in tiger stripes, so we would ask about anemia. Are you tired? A tendency for anemia within yourself or in your family. The yellow lipid deposits in the sclera here is called a pinguecula. So you ask about digestive disorders. Do you feel ill if you're trying to eat fatty foods such as butter or fried foods? Because clearly the liver has a tendency for not processing fats, and it's placing the fat in the sclera. Now, brown pigment around the outer edge of a brown iris is normal. That's genetic pigment. But when we see brown pigment out here in the sclera in a brown iris, we would ask about liver imbalances. And we also see here a pinguecula, which shows liver imbalance as well. So ask them if they have any problems with digestion, if they know of any problems with their liver within themselves or within their family. Here we see brown pigments in the sclera of a blue iris. Brown, light brown, rust-colored pigmentation in the sclera of a blue iris is not a good sign. This shows that the liver is definitely out of balance, a tendency for that within their family. And when it's presented in the sclera, you would also ask about liver imbalances, for example, digestive problems, and that kind of thing. Here we have brown pigments in a mixed eye out in the sclera, and that is not a normal sign for a mixed eye either. So we'd ask questions about the liver and concerns about digestion. We see the central heterochromia here, definitely showing a tendency in that family for digestive disorders. The tarry black pigment, as we see here in the top of this dark brown iris, is a genetic sign that's been there probably through generations. It can grow larger within a person's life. That pigment shows that there's a tendency for liver imbalance. Ask questions about the liver, digestive signs, but we want to make sure we look at the area it's located. It's located up in the brain area, and so we would ask about headaches, any headaches within the family, any headaches within themselves. And if they have serious problems, you always want to send them to a medical doctor. We see brown pigments here out in the sclera, and when they're close to the iris, like here, that's normal. But out here, that's also liver and digestive disorder tendencies. So this is an example of the brown, mixed, and blue irises. We see more color in the anterior border layer of a brown iris, less color in the anterior border layer of a mixed iris, and the least amount of pigmentation in the anterior border layer of a blue iris. All of these are genetic pigmentation. The dark brown iris comes from the hotter regions of the world, the blue iris from the colder regions of the world, and the mixed iris is genetic mixture of the two. When we see a lot of pigment in a brown iris, those people have inherited tendencies for blood imbalances. In a mixed iris, we see tendencies for liver and digestive errors. In the blue iris, lymphatic conditions, and we'll go over those more thoroughly a little bit later. But all of these are affected by how much pigment is in the anterior border layer. Here we see an interesting iris that I photographed to show you that a person can actually inherit both a brown and a blue iris within one iris. So what is so apparent here is that the brown pigmentation is covering the stroma layer, or the vessel part, or the stroma part of the iris. So we see that brown pigment in the anterior border layer covering the iris fibers. In a blue iris, there's lack of pigment or without pigment. The word heterochromia. Heterochromia means different. There's a difference. Hetero means there's a difference. Chromia means color. So here we have a heterochromia. There's a difference in color here from brown to blue. This is the term hypotrophic. Hypertrophic means extra, additional. So when we have hypertrophic, we have additional pigment in an area. Hypertrophic sectoral. Remember, sectoral means sector. So here we have hypertrophic sectoral heterochromia. A sector of extra pigment. Hyper means extra pigment in an area. So this is a hypertrophic sectoral heterochromia in the superior region in the brain reaction field. So we would ask questions about the head area, any dizziness, any headaches, and that kind of thing. Partial sectoral heterochromia means a partial sector is available there. It's showing part of a sector. It's not a complete sector, but it's just showing that there's part of a brown sector of pigment in the iris there. And the central heterochromia means that there's extra pigmentation in the central portion of the iris. We always ask questions about the organ reaction fields that we see the pigmentation located in. Hypotrophic means lack of pigment, where hypertrophic meant extra pigment. So in this case, we see a lack of pigment in this reaction field here. So there's a hypotrophic sector, which shows that there's a lack of pigment down in the groin reaction field. Now we're going to discuss two important terms in iridology that we can use with iris pigments. One is topostabile and one is topolabile. Topostabile means map specific. An example of that would be a brown pigment in the liver reaction field. Brown pigment anywhere in the iris means a liver imbalance tendency. But if it's in the liver reaction field, it's topostabile to the liver because it's brown. If a brown pigment was located in the kidney reaction field, it would be called topolabile to the liver because it's related to or affecting another organ or organs. So a brown pigment in the kidney reaction field still means liver, but it would be topolabile to the liver. A brown pigment in the liver reaction field is topostabile. If it's in the kidney reaction field, though, we can still ask questions about the kidney, but we would also ask questions about the liver. Another example would be an orange pigmentation. Orange pigment anywhere in the iris means a tendency for an imbalance in the pancreas. An orange pigment in the pancreas reaction field would be topostabile. An orange pigment anywhere else in the iris, for example in the thyroid reaction field, would be topolabile to the pancreas. Orange always means a tendency for pancreas imbalance wherever you see it. But if you see it in the thyroid reaction field, you can still ask questions about the thyroid, but you would also ask questions about the pancreas.